Hello, it's my pleasure to discuss the cardiovascular consequences of inadequate sleep with my colleagues, Dr. Nancy Redeker, Beatrice Renfield Professor and Director of the Yale School of Nursing Center for Biobehavioral Health Research, and Dr. Younghoon Kwon, Associate Professor of Medicine, who practices both cardiology and sleep medicine at the University of Washington. I'm Dr. Marie-Pierre St-Onge, Associate Professor of Nutritional Medicine and Director of the Sleep Center of Excellence at Columbia University Irving Medical Center.
Now, if I may discuss this from a sleep clinician's perspective, because I'm at the recipient end of actually seeing these patients who have been referred by others to address their sleep issues. I have to say that in practice, the majority of patients that we come across are those who have concerns about sleep disorder breathing, mainly obstructive sleep apnea. And I would say the second common one would be difficulty with sleep. This is a complex issue. When patient says they can't sleep well, it's hard to tease this out just by one test or just by seeing a patient. It may require some repetitive assessment along the time course to really try to pin down on what their problem is. Sometimes it's related to sleep apnea, and sometimes they're all interrelated. So this is not a simple question dealing with what the problem might be. Now, I have to admit that the field has put a lot of emphasis on the sleep apnea aspect of sleep management. But the downside of this emphasis has been that we often have overlooked other sleep problems. Insomnia, for example, circadian sleep disorders. These are big words that we hear about. Now, can we address them easily in sleep clinic or by sleep providers? The answer is not really. These are often a problem of complexity. So what that means is that we have to work with patients to better figure out and also come up with a solution that might be helpful. Now, I have to admit that even with the recognition of these problems, that the fact that sleep is a heterogeneous condition, in our current sleep clinic setting, sleep clinicians still face many challenges to address sleep issues that are beyond sleep disorder breathing. For example, for insomnia, there are certain therapies that are out there that can be potentially very helpful. Now, of course, to diagnose insomnia, it may not be as simple, but as I mentioned, sleep providers may be better at trying to tease out what sleep problems they might have. Having said that, I think something that we all as a clinician have to remember is that oftentimes it's not that we have to solve their issues, but what it really takes is patient listening and acknowledging their problem with their sleep, and hopefully that we come up with some words of encouragement that can make a real and meaningful differences. And I think that little art is what can really make a difference in our sleep health as well.